Good morning. And Dr. Eric Dinkins, welcome to Your Health Matters. How you doing, my friend?
Awesome, Carl. Thanks for having me on. This is exciting for me, and it's always great to talk to you. So good to be here.
Oh, great to have you, man. You're a part of and founder of this motion guidance company, which I love. We go back now 3 years. 3 years ago is when I started using the first system that I have here, with the laser and the various attachments and the things that came with it. And it's been an amazing tool in so many ways, right? So for our listeners out there, we're going to be talking today about a company called Motion Guidance out of Colorado. Dr. Eric Dinkins is with us, and he's one of the developers of this, creators of this. And I was wondering, as we get into this and talk about the various benefits, for example, athletes, physical therapy, improving movement precision, sports performance. We use it a lot for cueing posture, right? It's been beautiful for cueing different things for range of motion and posture and getting our people standing more upright and being mindful and aware of the fact of what it feels like when they're upright to be upright. So with all that said, we got a lot to talk about. How did you come up with this? What are the origins behind motion guidance and the technology that goes with it?
Sure. Probably 10 years ago now, I had a resident clinician in my clinic. His name is Tal Blair. He's the originator of motion guidance now, and we're business partners. But he had the idea that, while we were trying to have people understand movement of their legs during squatting activities, that one thing that we don't really do well in most clinics is provide visual feedback of movement. We use a lot of touching and tactile cues. We use a lot of auditory cues. And when we look into the literature, the vast amount of preferred learning when you're talking about understanding novel skill acquisition, it comes from our vision, right? And so the idea is motion guidance fills in a huge gap for most clinicians to be able to say, I get immediate feedback with the representation of a laser applied to any body part to see what I'm doing and how I'm doing it. You can use it to promote motion. You can use it to restrict motion. The posture example is a great one because that is essentially telling you how to restrict motion. If you have the laser across your chest and it's projected on one of our flags or the wall, if you start to change your posture, you'll see it right away, right? So especially with the population that your expertise is in with Parkinson's and movement disorder, that can be invaluable to have a person be able to say, well, I'm doing the skills that you want me to do, but I'm not doing them in the way or the position that you want me to do them in.
Yeah, absolutely. We found it highly beneficial for multiple reasons. And generally speaking, it seems like, well, I tend to deal with people pretty much age 60 and up. To be more accurate, more like age 75 and up, as 80%, at least 80% of who we deal with. And we love it, and it's fantastic. But we also know that most of them have a leaned over forward posture, and their head is protruding forward with the flexors pulling their neck forward, and so that just can really lead to some center of gravity and balance issues. Even though their brain has adjusted to this, it's still not optimal. And a lot of them don't have any movement disorder. This is not neurologically related, yet we have so many who do come in with movement disorders, neurological problems, especially Parkinson's and other related type of things. They're just natural tendency is to go more fetal in an upright position, and it's really nature's way of trying to protect us, but it can really throw us off and raise our fall risk, lead to falls, and all kinds of problems. So I love the visual feedback because it's almost like when they have this laser pointing at a target, we actually use the little things that come with it, right? I can stick them on the wall or something. Boom. put them in the position we want them to be at optimally, get everything late, and have them walk and try to keep it in the target, even in the big part of the circle, aiming for the small part, the center, the bullseye. But that is instant feedback. And I came up with a term. I'm sure it's not an original. I'm sure somebody else did, but I actually thought of it all by myself. I didn't take it from anywhere. It's called entrainment. Like you're in training, because I think we learn best when we can learn through how something feels when it comes to movement. I can tell you, oh, let's stand up straighter. Pull your neck back, chin up, shoulders back. You can try to do it and see how it feels, but when you're forced into it, it's a different thing, like visual feedback. So I love it. I'm rambling too much, but that's because I love the stuff so much, and I love talking about it and using it. Entrainment is like a game changer.
Well, I love that term. I haven't heard it. You need to write it down.
Okay, good. I started to keep up with something.
I think, at the heart of what you're noticing clinically, is the deficit that we typically have. So as far as training and awareness tools, our brain really is only able to focus on one thing really well at once. We try to train dual tasking, but as far as a focus point, one thing needs to become fairly inherent and have that automaticity. Something else, if it draws our attention away, then our system doesn't work well to do two things. Well, if you are telling somebody to stand upright or move a certain way, as soon as they start doing something else, walking, talking, an exercise, that tends to go away. The original cue that we were giving them verbally or kinesthetically. So adding on that visual feedback is a constant reminder of, no, we need you here. And that's why we also have home packs that people can get, so that it's a very slimmed down, inexpensive version of our clinical model, that people can say, well, I can do this at home, in the kitchen, in my bedroom, and wherever they need to get that sort of feedback.
Yeah, I love that you have that, and I think it's that's why I'm having you here. I want people to know about this, because these products, well, you have the home version. It's easy to use. You just you go through a little learning curve, and then bingo, you can just get started and you can practice, because that's the mother of all skill, right? Is practicing. The brain will learn.
That's
right. You'll entrain yourself, your brain, your body, your nervous systems. And before you know it, when you're not standing up optimally in optimal posture or closer to it, you'll know, and then you can catch yourself. And I love it. It's interesting, before we go to break, generally as we age, and I've talked about this on the show a lot, age 65 and up, if you fall and break a femur or a hip, statistically, a minimum of 30% of those people are deceased 1 year later. So we want to reduce falls, right? We're going to talk with Dr. Eric Denkins here more when we come back from break. You're listening to Your Health Matters. My name is Carl Sterling. We'll be right back. Friends, I'd like to introduce you to a new sponsor for our show. PowerPlate has joined us as a sponsor, and we are grateful for this opportunity to promote their products, because we use them in our clinics. As a matter of fact, we have 5 PowerPlates here. We have 5 because they're so in demand. It's the number one machine when people come in. They want to use PowerPlate. Why is that? Well, it helps people with so many different things, like diminishing pain, diminishing neuropathy, improving circulation of blood flow, lymphatic flow, and fascial fluid flow. This will help you to improve your flexibility and range of motion, clear out your lungs, increase joint stability and spinal stability, increase bone density, build muscle mass and strength. This will help you to improve gait and walking and stride length and stride symmetry, improve posture, wake up the brain, wake up the nervous systems. And I'm telling you, folks, it's a one-of-a-kind product. Be sure to go to carlsterling.com. That's Carl with a K. Go to the sponsors tab, look up PowerPlate, and check it out for yourself. We're back. We're talking about motion guidance technology. and Dr. Eric Dinkins is with us. So we did talk about posture in a previous segment quite a bit, a real important issue. Well, there are all kinds of things we can use the technology for because it's highly versatile. And I was wondering if you mind sharing about that with our listeners.
Yeah, absolutely. That's a great benefit of the system we created is that you can put it on any body part. You can put it on an ankle, you can put it on a leg, and put it around your hips, your trunk, put it around an arm, put it around your head. Probably some of the most common applications we have from clinicians currently is being able to put it around the head for head neck conditions. So concussion, headache, whiplash, chronic neck pain, dizziness, vertigo, a lot of those conditions we can affect by giving some visual feedback to train the eyes, to train how we move our head. And we know from the research that's published, we have deficits in these areas. We have things called the joint position sense error at the head and neck with a variety of different conditions that I mentioned. How the eyes are working can lead to deficits that could include dizziness or vertigo for people. And, we obviously need clinicians to tell us what a person is dealing with. We don't want people just to say, oh, I get dizzy. Perhaps I should, use this system or go see this clinician. We need someone to say, well, this is the condition that you have, and that's how you want to, work with it. But the versatility of the product is one that we wanted to allow clinicians to say, well, how do you need to use it? And
Sure.
That's how you can use the product.
It's great. Have you used this for vestibular work?
Oh, of course.
Yeah. I mean, I knew the answer was yes, but I just wanted to hear you say it.
Yeah.
People listening know sometimes I have a odd sense of humor, but next to me here on the wall, of course, if you're listening, you can't see it. But if you're on YouTube looking, you'll be able to see we have that right there, which is really cool, which includes a maze. We'll have people stand or sit or maybe sit on a stability ball or something to challenge their stability slightly while they're rather close to it so they get more range of motion out of the neck and the head. And also, their eyes are forced to track more the closer we get. And I'm wondering, do you mind explaining a little bit about, how does this work in terms of when we're moving our head, we're activating a vestibular system. When we're tracking our eyes, we have visual activation. Why is that so good for us most of the time?
Absolutely. The our system is definitely an integrated system that multi-systems are working together to create normalcy as far as adapting to the environment and giving us proper processing. You mentioned a few. There's other ones, an exhaustive level, and those all have to integrate with our body position as well, whether that's in standing or sitting or soft surface or narrowed surface, something like that. But the largest ones that I think most people understand is that the vestibular system, the inside part of our head next to our ears, needs to integrate with our eyes. If one of those systems is telling us one thing and the other one is telling us another one, you can get a variety of symptoms. You can get migraine headache, you can get dizziness, vertigo types of systems. You can get faulty awareness and chronic neck strain from those sorts of things that are mechanical nature. So you mentioned a few things within the system that you can utilize. But again, I think that the biggest take home is that the system works with a variety of different conditions. We have our own YouTube channel where people can get information about how to apply these things. You can also get those on motionguidance.com and see some of those publications that we have. The versatility of the use, the ease of the use with the system. There's just a limitless number of applications that a person can go through, and pretty easy to do.
Yeah. It is so versatile. I love it. So you have a large amount of physical therapy practices using the unit, and how about sports? let's talk about sports, because I know you're using it for athletes, and a lot of places are. So how does that work? What do you use it for when it comes to the athlete arena?
Yeah, I just got off a Zoom call last week with a clinician that's over in the UK, and she's using it for her athletes on the leg. So one application that she was utilizing is putting it across the front of the thigh, and then as her patients were lunging, squatting, jumping, the laser gives immediate feedback on what's happening at that femur over the tibia. If there's uncontrolled movements, you pick up on that pretty easily. If you're trying to work certain muscles through the hip or the trunk to control that knee, you can easily do that by maintaining the position of the laser. The most common, I think, vernacular there is going to be, knee valgus, where the knee drops in across toward midline. That's not necessarily a bad position, but if it's uncontrolled, that can put a lot of stress on, what we would call a passive restraint, which would be like your ACL, your anterior cruciate ligament. If we can't control those forces, that's when things can get bad. We need those motions to be adaptive and not restrictive. But if they're not controlled, then that puts us at risk for injury.
Yeah, absolutely. So you have also, and we'll probably get into this more in another segment, but, and I don't have these yet. I need to get these. I'm sorry I didn't get them yet. The pods, the interactive pods with laser, those are amazing. And do you mind sharing a little bit about what's happening in that arena?
Yeah, the interactive pods are becoming fairly popular. Ours is unique. It is the only pod system right now that can react with a laser and with touch, and it integrates with an app. And so in short form, our pod system comes with 5 pods, or you can get an expansion pack to 10. It comes with a laser and straps and an app that interacts with these pods. But the key into our pod system with the laser is it really allows you to dual task. So you can be up to 100 feet away and still interact with these pods with the laser. So you could be throwing a ball, crawling, dribbling, swinging a golf club. You can do anything from a distance and still interact with the pods. And we have a variety of more than 10 pod games that allow you to do different things for training. And it gamifies things quite a bit to keep you interactive, but it also tracks data. So it really just, the uses on that system, and that's our current model system, are just, pretty well endless at this point. And we keep progressing them based on professional feedback. So like the person I was talking to in the UK, if she has ideas, she gives those to us and we create more app games and expand the system. So that's great.
Well, I tell you, that is really impressive. It's really cool because I'm like a data fanatic. I want to measure everything I possibly can. And we have some pretty fancy stuff here to measure all kinds of metrics, from center of gravity to, body composition, which that's like old news, right? Body comp. But we want to know these things for everybody really, but especially certain people who have certain goals. And data, we'll talk more about that when we get back. We're going to go to a break, folks. We're with Dr. Eric Dinkins of Motion Guidance. You're listening to Your Health Matters right here on the iHeart Network. And we'll be back after this short break. Are you looking for a way to boost your mental clarity, sharpen your focus, and support brain health? I want to introduce you to a product I've been taking for well over a year, and that is the Dr. Lewis Daily Brain Care Formula, an all-natural solution designed to help you unlock your brain's full potential. It's packed with ingredients proven to enhance memory, support cognitive function, and protect against mental decline. So whether you're looking to stay sharp at the office, improve your concentration, or just looking to keep your mind active as you age, this formula is for you. It's backed by science, it's trusted by thousands, and it's never been easier to nourish your mind from the inside out. Don't wait to take control over your brain health. Get the clarity and focus you deserve today with the Dr. Lewis Daily Brain Care Formula. Go to carlsterling.com, that's Carl with a K. Go to the sponsors tab, scroll down, click, and check it out. We're back. This is Your Health Matters. My name is Carl Sterling. We're talking with Dr. Eric Dinkins of Motion Guidance. We're talking about the very, very cool technology they have, which we have in our clinic, and I just love it. So, Eric, the pods. Well, let's talk about the idea of gamification, because one thing I find really, really interesting on many levels, and part of it is maybe psychological, is that when people get involved with competition, let's just say with themselves, and maybe not anybody else, in the form of an activity that is gamified, it seems to be so engaging. It can turn into a fun activity. And if there's any, let's say, physical discomfort involved, they tend to feel that less, right? So it becomes more fun and less agony, for lack of better words. But tell us about more things, more the versatility of these pods, because they're like the coolest thing.
Yeah, absolutely. You're touching on, a lot of other behavioral aspects of pain and psych there also, and kinesiophobia, which is the fear of movement, because it will yield a negative, output there. The pods are designed to have multiple colors that can light up, they can flash, they can create sounds, they can interact with the laser, you can interact with touch. So you can even meet the demands of the patient. If you have a stroke patient that's not moving very well, you can have them, try the laser, they can try the touch. You can have a person who's more elite and just use the sound capability, which a lot of athletes are using for like an echolocation type of application. For your YouTube viewers, this is what the pod looks like. If you're not on YouTube, just listening to this, you can go to Motion Guidance, YouTube channel or motionguidance.com and look. But if I just hit the start button and I get my laser out here, I got another one kind of showing up here. But as these things light up, the target just turns it off with the laser. So that's essentially the benefit of the system. There is I don't have to be touching that per se. I can be from that distance, which is a pretty great thing. But the gamification, like I mentioned before, the attention for sustaining tasks, it keeps getting worse in our population for a variety of reasons. Not just the young population. Like my 17-year-old son, he's gaming and on his phone, and attention issues with that. But all the way up, we all have stuff on our mind. We're focused on our pain. We're focused on the reason we're there, and being able to have a distraction allows us to go through drills, and have that motivation, can be enormous just for creating movement, creating muscle patterns that we like or don't like, avoiding those types of things. It can just be outstanding for a patient engagement standpoint. And then seeing how you're comparing over time. People want to know, hey, I'm not just feeling like I'm getting better, I can actually see it. Aspects of our data collection in our app is specifically tied to the pod's color. So if you're slower to respond to certain colors or in certain forms of vision, like our ambient peripheral vision, what we call our dorsal stream versus our ventral stream of vision, you can have different reaction types or speeds to those. And that shows up on our app. And our next generation has that in graph form. So you can see, all the improvements right in front of you. You can send that to clients, or you can just look at it yourself. And we're trying to cover all of our bases for people. So,
well, that's great, man. I really love it, because I think I mentioned on the last segment, I really like data because we want to measure progress. And I think, there's an old saying, if you're not assessing, you're guessing. You can go with an educated guess and see certain things over time. But if you could really measure with data, see a graph, get some really dead-on accurate measurements, we can truly reassess and re-plan what we need to do. Where maybe we've improved and we can focus on another thing now that needs improvement or whatever, or integrating somehow. But really love the versatility, man. It's beautiful.
Yeah.
So let's talk about it. I was curious if we could talk about things like certain populations using it. I mean, this is not limited. This is everybody. It's really all humans, potentially, right? Because we can go from athlete to like post-surgical, post-stroke, movement disorder, or just somebody who just wants to get better at doing something, right? I mean, kind of, it's Ken Miller of NASM says, we're all an athlete. If we're up and we're moving, we're an athlete of sorts. We move in 3 planes of motion, and we want to do it right so we don't fall down. Do you mind talking about populations at all, and just your idea of the scope, like maybe examples that I haven't mentioned?
Absolutely. Just as a list form, athletics is an easy one. Anybody trying to retrain movement or, improve balance is an easy one. I mentioned before, concussion, movement disorders, trunk, neck, and back pain, musculoskeletal disorders as populations, but probably our newest space that we're getting into aggressively, based on the responses, is autism. So that neuro, atypical, however we're continuing to label these, because autism is such a different condition for each individual, but they all typically share some type of inhibition lack, where they can't, their prefrontal cortex is not allowing them to make the proper decisions and, perform simple skills like waiting or communicating. We're seeing in the school system now with our pods, and people like OTs and speech language pathologists are telling us that they can use it to the pod system to help gain sentence structure, and they can control it on the app to say, hey, which target that had a picture behind it was included in this story, and they have to decide it. They can interact that way. They can interact with it from a distance. They're using pods to say, okay, who gets to speak? The one with the lit up pod gets to speak, right? And so they can get into that space from anything as simple as that. I'm just trying to gain social interactions, all the way up to, more neurocognitive processing.
Wow, man, that's interesting. I just have in my imagination the whole thing about a picture and a story, and how it allows for a great deal of creativity when it comes to implementing different things, right? Different parts of the brain, different exercises for different parts of the brain. Well, I love it, man. This is absolutely fabulous. Well, I'll tell you what, folks, we're going to go to a break. We're with Dr. Eric Dinkins of Motion Guidance, talking about their really cool technology that I love. It's one of a kind. There's nothing else like it out there, and we love it in our clinic. We absolutely love it. So we will be back after this short break. This is Your Health Matters. My name's Carl Sterling. Really appreciate you listening. See you in a couple of minutes. All right, friends, if we didn't have sponsors, we would not be able to do the show. So I would like to talk with you about a special sponsor. The name of this company is called PlayOn Relief Pain Spray. This is very unlike traditional treatments for pain. PlayOn uses a special technology called DuraCool. This when you spray it on, it applies an invisible medicinal film directly onto the skin. You just spray it, you leave it. You don't even have to rub it in. Right? In this formula are a couple of really cool ingredients. One of them is menthol. Then we have camphor, and we have arnica. There's no big pharma. There are no chemicals. This is not a medicine yet. Spray on, and you're going to feel the PlayOn Relief, for probably 2 to 3 times as long as other leading things like Voltaren and other, things like that a lot of us are familiar with. So if you want to check this out, you can get a discount by going to carlsterling.com. That is Carl Sterling with a K, carlsterling.com. Go to the sponsors tab, scroll down the page, and you'll see the discount code to save 15%. PlayOn Relief Pain Spray is a one-of-a-kind. We highly recommend it. We're back. So, Eric, this is really cool. Wonder if we could just get into a little conversation talking about a few different things. One of them is, what's the future looking like for motion guidance? Because I know you always have ideas. I just love the ideas you come up with. You're on the cutting edge. But also the idea that a lot of people, they don't know that they can know about these kind of things. Like, for example, one of my favorite things in life that keeps me going and makes me excited every day is when I learn about something I didn't know I could know about. And so for some people, this is like brand new. Oh my gosh, I never even thought I could have a laser on my body somewhere and get involved in a game, and it could be fun. But it's also benefiting my brain, my nervous systems, my movement, my posture, my whatever. I mean, there's maybe my vestibular or my visual. Could you share your insights on, what you've experienced in that arena? Because it's so relevant for all people. Like, everybody can use this. Everybody pretty much. I can't imagine anybody who can't use it. And I'm thinking of somebody who's blind. Well, if they have... I was legally blind for a while, and before I had cornea transplants, but I was still doing things by feel and by sound. Right. So I just thought of that, but true. So yeah, share with us if you don't mind.
Yeah. Well, specific to that condition, each pod comes with its own decibel sound with it. So that even if you are not able to see precisely, you still should be able to see different shades of those colors, and then also the auditory response, just for localization, finding, proprioceptive depth, with reaching, how close you are to certain targets. Those things could be, really valuable for a particular individual. So anywhere between people who have a challenge that they're working with on a daily basis to, the people that are performing at the highest level in our societies, we've tried to, promote a system, develop and adapt a system that can reach all of those different styles. But you mentioned the brain interaction, the neurocognitive aspect. What we'll mention for that, having the brain be able to be flexible, or what we would refer to in the industry as plasticity. Having those adaptive changes from systems that are decompensated, because our body is constantly being stressed to compensate from our environment, how much light is out there, what surface we are, what sound is coming in, what our core temperature is, based on anxiety, and, all those things. We're compensating constantly. So if something's not compensating, we call it decompensated, and we have to train those systems to move forward. So, we've tried to get systems available at a very reasonable cost for everybody in the population. We continue to develop new things. We have what's called a neuro gym that's coming out, where it's, larger base backdrop that people can interact with our flags and our pods, and, does not have all the systems kind of come together. You need a little bit of space to do that, about an 8 foot by 2 foot space, so like a standard wall to put the backdrop up against. But constantly innovating, changing, trying to, get the people what they want based on feedback, which is another pride that we put in our product. Tal Blair and I, that, we take information from the community and say, we can't quite do what we want to do with this. Well, then we'll create it. We're trying to be as adaptable as possible for people. So any information that people need with that, they can find my information on the website, motionguidance.com. We, on the break, we were talking about this, but we have a code. Anybody that's listening to your broadcast, anybody that's looking at your YouTube channel, they can use MG as in Motion Guidance 20, MG20, for 20% discount off of anything at our website, for listening to you, just to even, make it more reasonable for people to acquire the product and start using it. So
I appreciate that too. We have a large audience of fitness trainers, personal trainers, group trainers, physical therapists, movement specialists who listen to this show. Many of them are outside the broadcast areas because they're listening, on recorded episodes. So this has a shelf life. I love it because it'll always be up forever after it's up. And, I can't recommend it enough because of it's so innovative, so creative, so engaging for the folks. It's so beneficial, especially when we can measure data, that if you are in any of the, let's say, professions I just mentioned, you really owe it to yourself, but actually even more so to your clients or patients to check it out because it's one of a kind. And I don't know if anything else like it out there. Boy, that Neuro Gym sounds really cool. That'll be, I have to get too.
That's going to be really, just providing a home base where you can do anything from, so you don't have to necessarily have 4 different flags that we have, which are great. You can put those in different rooms to do different things. But if you have a little bit larger space, we're trying to, kind of centralize everything so you can say, this is the area where I'm training, and this is the area that I can do everything I need to do in.
Oh, I love that. I just love it. So I was wondering, before we end in 3-4 minutes, I just have this thought about the brain and the nervous systems. One of the things I want to share with the listeners, and I'd really love to hear you elaborate on it because you articulate so much more effectively than I do. But when we look at the brain and the nervous systems, they are connected and they're a continuous loop, including the eyes, right? Because they are actually part of the brain. So if there's a break in anywhere in this system, or something gone wrong, let's say, it's not functioning right, it can throw a lot of things off. The beauty of being, human and having a brain and a nervous system, we can retrain ourselves. And that's really what this is all about, is to help either keep us moving better or optimally, or get us towards optimal movement so that we live longer, live better, more life in our years, let's say, rather than more years in our life. Because if we're moving, like John Rady out of Harvard always says to me, we were designed to move. We're not supposed to be sedentary. So this can help us to get moving better. Curious about your thoughts on retraining the brain, the neuroplastic aspect of things.
Yeah, I think it really comes down to movement and processing. We can move, but if we're not adaptable in those environments, if we're pretty rigid, if, to say it differently, if, things are very linear or black and white to our movement, and we can't compensate to a dog running at us, to the weather, to moving to get out of the way of something, to reach higher than standard. All those processing-based movements will lead to rigidity, weakness, inflexibility, and not just the muscle tendon kind, the inflexibility of like I was mentioning before, the decompensations of the brain interaction. And who knows where this goes in the future? I mean, we do have an onset of neural processing related, changes in things like Parkinson's, something we're both familiar with, that, perhaps there's more to it than just, well, I guess maybe I get it, maybe I don't, based on maybe some genetics or other things. There might be some other things that we might be able to do along the way to prime those systems to keep that neurodegenerative condition from happening.
Yeah, I love it. The whole thing about compensation is so important. If you got to get out of the way of something coming at you, or I got to chase my grandchildren into the road, I won't let them go there, but what if they did, right? Eric, man, it's so good to have you with us. Really appreciate you joining me today. Sadly, radio minutes are the fastest minutes of my life, and time flies. And we're at the end. We're at the end. Go to motionguidance.com, everybody, or go to carlsterling.com, Carl with a K. Go to the sponsors tab, scroll down to Motion Guidance, click through MG20, number 2 and 0, MG20. You get a 20% discount. My friend, thanks a million. Let's do it again sometime, and keep up the great work.
Absolutely. Thank you so much for the platform. Appreciate it, Carl.
You got it. Have a great day, folks.